First, Partners in Health has been in Rwanda for about 15 years. We were invited by the Rwandan government because it had a vision of trying to improve healthcare for its people. We have had extraordinary partnership here in helping us to build out that vision, in creating sustainable solutions for healthcare, as well as creating a wonderful pipeline of exceptional people. The government of Rwanda helped us with at least $50 million worth of resources in both bringing us to the campus, bringing water and power, bringing fiber optic cable here, working on roads and creating access, and really being the best possible host in working with the community to help families to move to other sites so that we could in fact have this overall facility and this campus. After that, we've had philanthropic support. Bill and Joyce Cummings, fabulous philanthropists in the Cummings Foundation, made a Sentinel foundational gift, and they then attracted the Gates Foundation and Bill and Melinda Gates to make a similar gift to really get us started. The gifts from then on are going to have to be other kinds of philanthropy, contracts, and other work to be able to support this work going forward.
We definitely want to keep the quality of education high, and that is our greatest focus. And of course that comes with a cost. Our biggest motivation and focus is to attract the bright students to come and learn with us. And we always want to help them financially to be able to do that. We work with our partners to have as many scholarships as we can. Currently, for the students that we have enrolled in the One Open program, we have spent about $1.8 million in form of scholarship offered to the students. So we want to do more of that by mobilizing the needed resources to support those students who really are competent and willing to learn with us, to make positive change on the world, and we support them to get access to that high-quality education.
I'm coming from the U.S. and I am fortunate to be a part of the University of Global Health Equity's fourth cohort of Masters in Global Health Delivery students. I applied because I saw a program for the first time that was very much rooted in equity and working with people and walking with people and learning from people, and I couldn't find that anywhere else. So I decided, why not take a leap and go to a small country called Rwanda and have an adventure for a year.
Now, according to statistics by the World Health Organization, Africa needs at least 2 million doctors, nurses, and health workers. Worst thing is that this number is set to double by 2035. Now, how can this be reversed? Is the University of Global Health Equity a solution to this?
The deficit only doubles if we don't start working now. If we don't start first creating systems and understanding how we can create efficiency in those systems, having everybody covered so we can look at population health as opposed to only having the transactional health that one gets from doctors and nurses. We need to have various skilled people up the chain to doctors and nurses, and we need to work in partnership in places where there are the ability to do distance kind of consultation, to do telemedicine so that some of the specialty burden can be centralized and not need to be disseminated out to the people so that we can extend the talent that we have, and then also to really invest in pipelines of great nursing education, and great physician education, and great science education.
The big majority of clinical education are done in cities for years, 4 to 6 years, 7 sometimes, without specialization. And after those years, you ask people to go and provide their service in rural area. They are afraid. They believe their life will be boring, cut from their friend, etc. Here we do the reverse. We educate here people that can work everywhere, but they will be comfortable to work in rural area. And across the world, we have as much people living in rural area than in urban area. However, a rural area needs more clinicians to care for them than urban area. So we are part of the solution. UNICEF has done a study showing that if we invest in the health of the poorest kids, we have 4 times more return on investment. So it's not only a moral imperative to care for those who cannot care for themselves. We train our nurses, doctors, psychologists, nutritionists, veterinarians, how to help those people to have access, geographic access, financial access, human resource access, and gender equity, in a gender equity manner, also in an age equity manner. And we have a vision that every person, whatever place they are on earth, whatever origin they are, whatever person they are, have access to quality care.
The academic institution, rooted in Burera District, focuses on training the next generation of global health professionals. Now, what are some of the expected challenges for both the institution and the students?
There are always many challenges when you are trying to challenge the status quo, right? You're trying to put up great facilities like this, learning environment like this for people to stay here, have warm showers, great facilities, just like the ones that they would have in cities. So the challenges are around, of course, the challenges that face rural communities, and we are working around that to make sure that we prove to the world that this is possible, this can work.
As students, I would say, for example, for myself, I haven't yet been exposed to a lot in the real world, so I'm having to learn all the information and quickly adapt it into the real world, because we have a lot of, say, practicums, which are when we carry out projects in the community to solve a particular issue. So you have to get out of that comfort zone of just being a student and in the books into just balancing it both with actions, and we're accountable because we have to present this information to the staff. But it's really nice because all of my classmates, my colleagues, they are professionals in many different fields. So it's been really good to get together and work together. And especially because they're from different countries, they also have diverse type of experiences.